Hi, my name is Dr. Spencer Hawkins. I'm a board-certified dermatologist and a fellowship-trained hair restoration surgeon. I'm also the founder of Hair Medicine Institute in Atlanta, Georgia. Today I'm going to be discussing oral versus topical minoxidil. Which one is better? There was a study published in JAMA in 2024 that compared these two interventions, and they ultimately concluded there was not a significant difference between oral and topical minoxidil. But there are two problems with that study. One, you're comparing apples and oranges. On the one hand, their oral minoxidil dosing was once a day, whereas the topical minoxidil, it was twice a day. The other problem with that study deals with the data itself. If you actually dive deep into the literature, you can see at the frontal scalp there wasn't much of a difference between the groups, but at the vertex there was roughly a 24 hair count difference between oral topical minoxidil. It just didn't reach statistical significance, meaning they might not have had enough patients in the study. There was a subsequent study in August of 2025, so just a few months ago, that actually compared oral minoxidil once a day and topical minoxidil once a day, and that study concluded that oral minoxidil was superior. In my clinical practice, I generally recommend oral minoxidil. I find the results are superior, and I think that supports what the literature says if you really dive into the nuance.